resources with the health department.
For sure.
So.
Yeah, I learned a lot from this incident, so hopefully I'm sharing stuff with people that's new and different here. Well, we'll get started. It's 10:45 exactly, so I like to start on time. I think, Gary, you're going to keep admitting people as they join. Is that right? Okay, perfect.
That's correct. Yep.
Okay, so everyone should be able to see my screen, and I'm just going to dive kind of right into the presentation here. So, whoops. All right, so I just basically, before I kind of start with discussing the incident that happened with our summer school and then what resulted with county health, I wanted to share with you some of the protocols that we actually had in place, which we think some of these actually contributed to lessening the amount of problems that we had in the long run. So it was a 4-week summer school. It was half day, 8 a.m. to noon. We didn't allow any eating on campus, so we did distribute sack lunches at the end of the day for take home. And all of the classes had 15 students or less, and students remained in these cohorts all day. Students washed their hands upon arrival. Throughout the day at breaks, the bathrooms were sanitized every hour and after every transition from an activity. So if they left the room for recess, or if they transitioned to art or PE, the bathrooms and the rooms were getting sanitized at those times. All the surfaces in the classroom, including the door handles, sink handles, equipment, or any other item that is not the student's own belongings, but came into contact with more than one student, was sanitized after students vacated the room for recess or other activities. And we sanitized using 1-gallon weed sprayers that were on the mist setting, and we were misting a 5% bleach solution. We didn't use water fountains. Students had personal water bottles, which were labeled. Masks were optional, and I will tell you that no one wore masks. No one chose to. My staff didn't, and neither did any of the students. And we did not allow any volunteers or visitors. And we used the playground equipment in cohort groups, the groups of 15 or less. We did not sanitize the playground equipment because it was not practical to do so. And all of these protocols were put into place in conjunction with our county health department and agreed upon before we started the summer school. In addition to having the protocols that I just discussed in place, we also had this algorithm. This is what it was called, this illness algorithm, which the Jefferson County Health Department gave to us to use so that parents could identify if their kids should or should not be in school. And so this was the illness algorithm that parents were issued, teachers were asked to use, and we did have one incident, I think it was the second week of summer school, where we had someone who had a fever, and we followed this protocol. They actually got tested for COVID and came back negative. So we did utilize this protocol before our actual positive cases. So if you don't have some sort of protocol in place like this, you're definitely going to want something like this for the start of the year. So the third week of summer school, so third week of a 4-week summer school, we had 3 students who were siblings who contracted COVID over the 4th of July weekend. And we discovered this, of course, like a week later. A cluster of positive cases was traced to the camping trip that they attended, which involved 50 or more people. And there was over 40 cases that resulted from that camping trip. The family was informed of the exposure Thursday, July 9th. So the students did go to summer school Monday, July 6th through Thursday, July 9th. And they were in their classroom groups, and they did not get tested until Friday, July 10th, which was the day after they were informed you might have been exposed to COVID on your camping trip. And they were informed by the county health department from another county when they were doing contact tracing on that camping trip. The school was actually not informed of the students' positive tests until Saturday, July 11th at 9:30 p.m. I actually took a phone call. I saw the county health nurse was calling me. That's never good on a Saturday night in the summer. So I took the call, and she basically just said, you have 3 kids in your summer school that have tested positive, we need to start the contact tracing process right away. And I said, we need to start it tonight. And she said, yes, we plan to start making calls tonight. And we will continue those calls in the morning. So I was not told the names of the students. I was simply told what classes they were in the summer school. And the information that the county health nurse had came directly from the parent of the students. And so immediately there's kind of an issue right there, depending on what kind of information they get from the parent, whether they're not forthcoming or they don't know the kid's schedule, or they neglect to mention whether the kid is involved in additional things such as sports or riding the bus or whatever. County health may not have all the pieces. So that is a challenge that we have to kind of help them work through, I guess. And the direct contacts that resulted from that were notified by county health on Sunday, the July 12th. The school notified all of the other parents that summer school was shut down that same Sunday also. We said summer school was shut down for the week of July 13th. On the next slide, I'll kind of talk about who got notified as a direct contact and how they determined who was a direct contact. So one second here, I'm going to go through the immediate actions and then I'll go into that. Sorry, I forgot the order of my slides. Okay, so immediate actions that were taken. Information was provided to County Health Department on the evening of Saturday, July 11th, and that included the list of students in each classroom where the exposure occurred. So they wanted the class list. They wanted the parent contact names and numbers, phone numbers for each student, the summer school attendance for the affected classes for the week of July 6th, and the recess schedules. That was everything that they requested immediately that night. In addition, immediate actions we took on our end was to communicate to the school board that this had happened and to the school principals, because we knew that once the contacts started happening from county health, it was going to go like wildfire in the community, that we had these cases in the school. And so it was important to let our school board know, yes, this was true. And yes, county health was taking the actions to inform people of their possible exposures, and basically just expect that this is going to be the case. Considerations that you should have regarding immediate things that you need to do. All of that information that I had to get to the county health department, which included the class list, the parent contact names and numbers, the attendance, and the recess schedules, had to be faxed to county health due to HIPAA. So immediately, I was at home, of course, when I took this call at 9:30 at night. I thought, fine, I'll jump on Infant Campus. I can print out these reports, email them, or save and email them to county health. And she said, no, I cannot email them to county health. Due to HIPAA, you have to have certain encryption available on your email systems for both the county and the school, and neither one of us had that correct encryption. And so the only way I could get her the information was through fax. So due to this coming to light, we are going to put some faxes in the homes of our administrators and our school nurses, so that on evenings and weekends, or when we're not in the office and we need to get this information ASAP to county health, we have the ability to do that easily, and not having to come into the school. The other issue with having to come into the school is, depending on the contamination and where the cases were, they want you to shut down your buildings for 2 to 5 days after you have an incident. And so you might not have access to the building itself. And so having an offsite fax available to send all this information makes sense. The other thing this kind of brought to light for us was the necessity of having on-call staff, whether that's an administrator or school nurse, for evening and weekend contacts by the county health department. Again, I took that phone call at 9:30 on a Saturday night. And so that just brought to light for us that unless we all want to be on call all the time, we need to develop some sort of schedule in our district of who is going to be on call evenings and weekends in a particular time for county health to reach out and get that information that they need right away. So the quarantine criteria. So this is a criteria that they used in order to quarantine staff and students. And on my next slide, I will show you kind of the effect that had on the classes. But just, this is really important information to know, because I did not know this going into the summer school setting, even though we had worked through with the county health nurse, all of the protocols that we put in place for cleaning and cohort grouping and all these things. We never really talked about what would happen once we had our first case. So contact tracing to identify the direct contacts with the infected people occurs for the 48-hour period preceding when you took a test resulting in positive or the onset of symptoms. So in this case, we know that the students were exposed to coronavirus at some point July 4th weekend on this camping trip. However, County Health only contact traced the 48 hours that preceded the positive tests, which were administered on Friday. So that put all of the contact tracing back to Wednesday only. So it would seem intuitive, like they would just contact trace all the way back to when these kids were exposed to coronavirus if they knew when the exposure happened, but that is not what they did. They only contact traced that 48-hour period before when they took the test that resulted in the positive. So they took the test on Friday, so therefore contact tracing only occurred back to Wednesday. So all of the students and staff that were in contact with these students for 15 minutes or greater during that 48-hour period received a 14-day quarantine. One of the questions that we asked was, would masks have offset the 15 minutes of exposure generated by being in the same classroom? Would that have made a difference in who got quarantined and who didn't? And we were told no. Regardless of if they had been wearing masks, they would have received the 14-day quarantine. And so there's kind of a difficulty there in selling people on wearing masks when it doesn't actually change the outcome of the quarantine, though it certainly may change whether or not they get coronavirus or not, or whether they pass it on to somebody else. Another important thing that we learned was you cannot test out of the 14-day quarantine. And I don't know if this is protocol that is followed in every single county to this effect. I did see some information sent out by Dennis Perman this morning in an email, and I believe it was from Massachusetts where he had gotten the information. And in their particular protocol, they were saying that people could test out of the 14-day quarantine and that they might only have a 4 or 5-day quarantine, depending on when they got those test results back. We specifically asked if that would be the case, if people could test out, and we were told no, you could not test out a 14-day quarantine because there is every chance that you will develop coronavirus at any time during that 14 days, that basically you won't test positive unless the virus is actually active, and that it might be dormant in your body and not activate until some point in time during that 14 days. So once you're in quarantine for 14 days. Another interesting thing was secondary contacts were not quarantined. So for example, the family members of people who were quarantined or other staff and students in the building, anyone who came in contact with the kids who came in contact with the infected individuals was not quarantined. So the interesting thing about this is you have a second grader who's quarantined, and then the rest of the family may not be quarantined because they didn't go to summer school or they weren't around the infected kids. But it does result, especially for those younger kids, in kind of a secondary effect because someone is staying home with that quarantined child while that takes place. And so kind of to break down our incident a little bit further as far as what happened and, whoops, hang on here. I'm looking at the chat here. Let me see if I have anything here we need to answer. Someone asked me if I could share the protocols. I definitely will share this entire slideshow. You'll have access to that on the SAM website after this presentation. How did they get results so fast? I'll talk about the timeline of results in another slide. We have another comment. Seems like masks may be a waste of time in the exposure game with positive results. Yeah, I'll talk a little bit about what happened with our not wearing of masks and the outcomes for our students, and you can certainly weigh that in your decisions. Is the test out rule for all of Montana or just your county? My understanding from county health is the test out rule is how DPHHS Montana is handling it, and that is not specific to our county. That is a statewide expectation that you remain in quarantine and for the full 14 days. All right, so going back to the kind of summer school situation, just so that you have a better idea of what happened and how certain groups ended up in quarantine and certain groups didn't. All of these students that were positive are the plus signs. So the red plus signs are all the positive students, and you can see that they were in our first grade classroom, our third and fourth grade classroom, and the 7th and 8th grade summer school classroom. And the students that ended up in quarantine and the staff that ended up in quarantine are all the dark blue. And so our first grade classroom, the staff and students, all of them that were around that one individual in the first grade classroom that had a positive COVID test, all of those staff and students were quarantined. So we had a teacher, a para, and all the students. Similarly, in our third and fourth grade classroom, there was an infected individual. The teacher and all the students were placed in quarantine. So you may ask, why did the second grade classroom get placed in quarantine? And this is something that, you know, is just really important to stress with your staff, because they got placed in quarantine due to poor staff decisions. And what I mean by that is our protocol actually stated that kids would remain in cohort groups and they would attend recess only in their cohorts, and that they would be separated out at recess time. And we were 3 weeks into summer school by the time this happened, and the teachers felt pretty lax about things. And I think they were kind of feeling like maybe they were back in just a regular year of school. And what actually happened that week is the second grade classroom did commingle with the first grade classroom for recess. And recess was 15 minutes in length. And because of that commingling, which should not have happened, that teacher and that classroom also got placed in quarantine for 14 days. So that is a situation that absolutely could have been avoided had we kept those recess groups separate like we should have. So it's just really important to stress to your staff, like, it may seem at first that, you know, everything's okay and there's really no reason that we should be doing this. But if you cross-contaminate groups and someone does come down positive, there's going to be that ripple effect of other people getting quarantined that maybe did not need to get quarantined. So that is what happened with the second grade classroom. Also, our specials teachers, that was art and PE, those teachers were traveling class to class. They obviously had more than 15 minutes of exposure, both in the third and fourth grade classroom and the first grade classroom, with those infected individuals, so they were quarantined as well. Interestingly, this is back to those kind of secondary contacts. It would kind of stand to reason, almost like anyone those people came in contact with might need to be quarantined also, but that doesn't occur unless those people test positive. So it is just those individuals that were quarantined. So you're probably wondering what happened with 7th and 8th grade, because that class did have a positive student. And although they had a positive student, they did not end up getting quarantined. And the reason that occurred is we only had the 7th and 8th grade summer school class occurring one time per week, and that happened to be on Tuesdays. The K-5 classes were actually coming every single day. So because of that 7th, 8th grade class only happening on Tuesday, if you remember back to how I explained the contact tracing works, that they only get contact traced for the 48 hours that precede the day that they take the positive test. So this kid took the test on Friday and tested positive, so they only contact traced back the 48 hours preceding that test, which would have been Wednesday. So all of the kids and the teacher that this kid was in contact with on Tuesday did not get placed in quarantine. And this caused some ripple effects. I'll show you in another slide kind of the effects this had in our community, but there were some secondary effects and some confusion coming out of that situation. And so really, The only classroom that had kind of no disruption at all was the 1 5th and 6th grade classroom. Now I've also highlighted these two individuals with yellow. So you see the teacher in the 7th and 8th grade classroom is highlighted with yellow, as well as the student over in the 1st grade classroom. I think this is just kind of a good case study in the sense that the student in the 1st grade classroom that's highlighted yellow is the son of the teacher in the 7th and 8th grade classroom. So in this case, the child who was in direct contact with the infected student in the 1st grade classroom was quarantined, but the parent, who was the teacher in the 7th and 8th grade classroom, was not quarantined. And that had everything to do with the 48 hours of exposure that occurred, and basically county health only going back that 48 hours of time. So Travis, I think that was your question. I answered. All right. So that's kind of the breakdown of what happened. And then of course, there's all these secondary things that came out of this, which I will proceed on to. So other lessons that we learned coming out of this: getting test results takes a long time depending on which route you go. So the people who went directly to their healthcare provider had way more speed, and they had results in 2 to 3 days. The people who went to the county mass testing centers, and actually we didn't have a mass testing center in Jefferson County, so they went over to Silver County to Butte to get tested. They actually went on the Monday after the Sunday that they were informed about their possible exposure. They got test results back. Some of them are just getting them back like yesterday, today, once their quarantine had actually been completed. So that is something to take into consideration. Remember, they cannot test out of quarantine. The quarantine does occur for 14 days because of the dormancy of the virus. But regardless of whether they can test out of quarantine or not, they're not getting kind of time-sensitive information. So if any of those people had been positive, they would not have known it the whole time they're around potentially other family members in their home where they're quarantined. Another interesting thing was the shared playground equipment was not a concern, but the shared recess time was. So as far as determining who went into quarantine and who didn't, the recess equipment got shared by everybody. And we didn't have any special sanitizing protocol for that because it's impractical to do that. And county health was not concerned with that. They were only concerned about if the kids had actually been out on the playground equipment at the same time for 15 minutes or longer. Another interesting oddity is if you don't live in the same county as the school, your home county will be the county administering your 14-day quarantine. And so in our case, we had teachers that lived in Silver County, Madison County, and Jefferson County. And so all of those county health departments were involved as far as quarantining our staff. And I think this is the biggest thing. We had no students or staff get COVID as a result of the summer school exposure. And I guess I should say we have no known students. Not every single person chose to get tested, but all 29 of the students and 6 staff members either tested negative or completed the 14-day quarantine with no symptoms. And no new cases in Jefferson County have been traced to this exposure. And now we are a full 2 weeks out from when this happened. So if it was going to happen, it should have happened already. So that was great news for us. As far as, you know, just, it seems like whatever we did worked, or kids aren't transmitting it as much as maybe we think they can. A couple questions here. We did not have to disinfect the recess equipment. No. So when we did our plan with county health, basically our instructions were to have, you know, recess and cohort groups, and that we discussed whether or not we should sanitize the recess equipment, and basically because it's pretty much impossible to do it due to the volume of the space and then getting up and around everything. Ultimately, it was decided that we weren't going to, and that was with the permission of county health, that we did not sanitize the recess equipment. And And then the other question we have here in chat is, was the response by all 3 counties similar? Yes and no. So the 14-day quarantine was definitely upheld. However, some of the counties did not actually issue written quarantine notices. Jefferson County did. Silver Bow did not. And Madison County did issue a written quarantine notice in addition to just informing people over the phone. Also, as far as kind of the ripple effect of this too, one of our teachers lived in Madison County, and she was actually scheduled to have her wedding the next weekend, and that would have been the weekend that fell right in the middle of quarantine. And Madison County did make her cancel her wedding. So that was a really horrible unintended side effect of all of this. Was one of our staff members had to basically postpone her wedding because she was in quarantine during the time she was supposed to have it. So other questions. So dividing your playground in half for cohorts really doesn't work unless there's a lot of space. Yeah, no, the cohorts definitely have to be distinct. There needs to be enough space to where the kids were not together at any point for the 15-minute span of time. That 15 minutes is really critical. And so the 15-minute knowledge was kind of freeing for me to know, because the implications it had for passing period for middle school and high school was positive, and to the extent that passing periods are 4 minutes for us. So they would never be together for 15 minutes. So that wasn't an area where we'd have to contact trace everyone if we had someone come down positive. Is there a recommended distance for the 15-minute contact tracing? I've heard 3 feet, 6 feet, and no distance requirement. So that's interesting, because we also asked about that. So we asked about if the kids had been spaced 6 feet apart in the classroom, which would have been pretty difficult to do. You just don't have enough square footage. Would that have mattered? And she said, no, basically you're breathing the same air. It's aerosolized saliva that kind of carries the virus. And so being as you're in that same classroom, whether you're 6 feet apart or not, if you're together in the same space, basically the same classroom for longer than 15 minutes, you are a direct contact, regardless of if you're 6 feet apart and regardless of if you were wearing a mask. So neither one of those things would have prevented us from having kids go into quarantine. I agree with Shauna. She's saying she's being told the opposite, that they need to disinfect playground equipment. So it definitely depends on your county health department, for sure. I think that's part of the frustration that we'll all deal with, is that things are going to be different depending on county health and what they require. It is interesting though that none of those 29 kids came down with COVID, and we were not disinfecting the shared recess equipment. We were disinfecting all of the stuff in the classrooms, stuff that they had been in contact with for longer than 15 minutes, and the bathrooms as well. Okay, moving on here. So this is the letter that actually went out to the families and the parents and the staff if they lived in Jefferson County. Remembering some of these people lived in Silver Bow and did not receive anything, and then Madison County sent out a very similar letter to this. And I wanted you to see this because it is an alarming letter. I mean, how it's worded is pretty strong, and there's lots of laws, and it talks about the fact that you can be fined and go to jail and all sorts of things. So if you read through the letter, basically it says you're ordered immediately to and this is by the order of Jefferson County Health or the order of the court, to stay at your home for the period of time, and then it identifies, basically when that 14 days is up. And so in this particular case for this student, that 14 days was up on the 24th of July. And then you have to limit all activities and interaction with other persons living outside of the home. So you can interact with people in the home, but you can't interact with anyone outside of the home. You cannot go to school, so it specifically limits you from going to school, a house of worship, work, or out-of-home daycare, stores, or other public areas. Only the people authorized by Jefferson County Health can be in the home during the period of quarantine, and so they basically ask who was in your home at the time you were quarantined. And there's a question here, do we send the letter out or does the county health department? We do not send the letter out. This came directly from county health to the quarantine staff and students. It was sent out by the health department. And then if you object to this order, you can request a hearing in court in accordance with Montana law. And I will say that we had a staff member who was pretty upset by the fact that she was getting quarantined, and I'm told was kind of rude to the county health people when they called her. So you'll definitely want to have a discussion with your staff about how to accept those calls. I did have to have a conversation later with that staff member about, you don't shoot the messenger, just listen to the information they give you. And it is your legal obligation to comply with that order, how you feel about it. And perhaps arguing with the county health people is not how we want our school and to be represented by our employees. So I do think, that's a conversation I intend to have with my entire staff this year. And it was something I hadn't really expected, was pushback from my staff to county health when they got this notification. The order kind of ends with basically the law and the fact that if you choose not to abide by this, it can be a misdemeanor. And if you're convicted, you can be fined up to $500 or imprisoned for not more than 90 days. So it is kind of an alarming letter. And then all of the legal references are cited on the back. So that is the letter that most of the students and staff members received. And then this is the order that they received, basically a release from their quarantine. And so there's actual documentation that they were allowed out of quarantine. And obviously there's things that can happen in that 14 days, which would make it so that they couldn't immediately get out of quarantine, such as if someone else they were in contact with in their home, or if they themselves had tested positive during that 14 days. So 14 days is really the time that they remain in quarantine, so long as something else does not occur. And then I kind of alluded to this previously, but there was some secondary fallout that occurred as far as, especially in regards to that 7th and 8th grade classroom, the one that had been in contact with the child that tested positive, but because of the fact that the 48 hours of contact tracing occurred, they basically weren't put in quarantine. So because we're a small town, although county health did not identify who this family was with the 3 kids that had tested positive, it wasn't very long before everyone kind of knew who this was. And this was because the parents chose to share with other people in the community that that was their family that had tested positive. So once word kind of got out about which family this was, and none of that came from the school, that was again just kind of through the grapevine and coming from the family itself. All of the parents of students who were in the 7th and 8th grade classroom with the child who had tested positive, but had been in class with these kids on Tuesday, which they did not contact trace back past Wednesday, were quite alarmed. We took a number of phone calls at the school, and Jefferson County Health Department took a number of phone calls of people saying, well, how come my child isn't being quarantined, or how come you're not suggesting my child get a test? Obviously they were around a child who tested positive. They were just around them on Tuesday instead of Wednesday. And basically county health kind of described their protocol. And there was a number of people who were very dissatisfied because they felt like whether it was Tuesday afternoon or Wednesday morning that you were around these kids, that there was still a chance that people would potentially get positive or come into contact enough to where they could have contracted it. And so there was a number of parents who self-quarantined their own children as a result of this. There was a number of children in the 7th and 8th grade who self-quarantined. And this caused an unexpected problem in the community because one of the people that chose to do this worked at the bank, and the bank thought that they had been placed into quarantine by county health. And as a result of that, our bank shut down for about 4 days until they sorted out that there actually wasn't a county health order, and they had not indeed been notified that they were a close contact. And basically the situation was, for all intents and purposes, kind of like self-diagnosing. So they put out this advisory on Facebook, which basically said, if you've not been notified by county health, you have not been identified as a close contact to a known case of COVID. Self-diagnosing yourself as a close contact causes disruption in a system that is working, and we ask you to please refrain from doing that. So I definitely think this is a situation that is going to happen regardless of how many times county health says this. I do think that the 48-hour time period, people were off-put by that because they knew that this family kind of identified that they had gotten COVID over the 4th of July weekend. So the fact that they were in school all week really meant that perhaps anyone around them all week could have gotten COVID. So it's something to think about, just kind of the ripple effect that happens as a result of the quarantines. So some of the implications for this, I'm sure you've been thinking of these all along as I've been talking. The crossover between student cohorts has to be reduced as much as possible. Obviously, the mistake that the 2nd grade classroom made by going out to recess with the 1st grade classroom was massively unfortunate because it caused, 10 additional kids and 1 additional teacher to go in quarantine that absolutely didn't have to. So that was too bad. As far as the other things, teachers can't deviate from the plans on cohort groupings because that does cause serious contact tracing issues. In this case, the teachers were forthcoming about it and said, hey, we had this recess. They were out together for 15 minutes. They actually kind of self-identified and turned in that situation. But obviously, depending on if you're aware of how they're maybe not following the plan, that could cause contact tracing anomalies, which could, of course, result in viral spread if you don't know who is with whom when. I've already talked to my staff about this in staff meetings, but the social or professional interaction between teachers has to be reduced as much as possible and always less than 15 minutes in duration, because one 30-minute staff meeting, if you do it in person and someone tests positive, you've just wiped out your entire staff just by having a staff meeting. So I've told my teachers to expect that we're going to be doing staff meetings via Zoom for the foreseeable future. And if we do have to have face-to-face interaction, it needs to be for less than 15 minutes so that we aren't ever considered close contacts and we don't have to contact trace in the event of someone turning up positive. Obviously, any shared staff are just more likely to have exposures and cross-contaminate groups if they become sick themselves. So the principals, the secretaries, the special teachers, the SPED staff, the entire 612 teaching staff in the case of my district, all of those people come in contact with multiple cohorts. And so the chance of them either cross-contaminating groups or coming in contact and getting quarantined is just that much higher. I've talked to my principals about the fact that, all discipline conferences with kids need to be less than 15 minutes, which hopefully that, unless it's something really serious, that can be the case. Obviously, visits to the secretary or how you do detention or in-school suspension, all those things, you have to think about that 15-minute duration. We've talked about in our district, if a kid is in in-school suspension, unless they can be by themselves somewhere where they can be monitored adequately by staff, they probably have to do that at home. I don't see that, they can't sit in the principal's office to do their in-school suspension. That's another close contact situation, and we don't want to create all sorts of unnecessary contacts. So you have to think about some of those kind of odd scenarios too, how you're going to handle those in regards to the 15 minutes. So the remaining staff and students who were not placed in the 14-day quarantine could return to school after the school had been closed for 2 to 5 days. And so the 5th and 6th grade classroom, which was unaffected, and the 7th and 8th grade classroom, which was not placed into quarantine, the one student who was infected. But the rest of those kids could have returned to school on Tuesday of that week. And we only had 3 days of summer school left in that case. And so everyone was pretty worked up and kind of touchy at that point. And so we actually just made the decision to not have those classes those last 3 days. And so we actually just ended our summer school early, but we could have returned to school. And of course, during the school year, you know, we're going to have to just pick up the pieces as we can. And so we would resume school for the kids and the classes and with the staff that was not in quarantine. Another situation, of course, that you have to think about is all the other cohorts that exist. And so any bus cohorts or after school programs or any sports teams, these are places where, again, we have the cross cohort grouping. And so these settings cause more staff and kids to be placed into quarantine. And so the example that I was using, you know, with my staff when we were kind of breaking this down after it occurred is, my daughter is a freshman this year, and so let's say she gets ill, so she is going to take out all 7 classes that she attends. All 7 of those staff members would have to be placed into quarantine, plus all of the students that she is with in those 7 classes. And so depending on how, you know, many kids, unique kids there are, that could be probably around 50 kids. And then because she has PE, well, she has obviously infected that staff member who is also our football coach. So although, you know, she's a female and she's on our volleyball team, she's infected potentially our volleyball team. So they have to be in quarantine along with their coach. And then not only so, our football coach would have to be in quarantine, and any of the football players who are in class with her would have to be in quarantine. Same with cross country. And so you can see that there's a huge snowball effect from this, whether you like it or not. And so, you know, MHSA came out with those guidelines yesterday, and I think you can see really quickly how you would be moving out of tier 1 if just one child comes down with anything in any classroom. All right, moving on here. All right, so considerations for cohort grouping. Coming out of this situation, some of the things that we thought about are, you know, really some models work better than others due to the quarantine protocol. So if you're really only contact tracing for 48 hours preceding onset of symptoms or a positive test that you've taken, it's the day you take the test, not the day the results come back. This kind of results in least restrictive and more restrictive cohort groupings that you can plan. And I think depending on your level of illness, you'll want to implement them accordingly. But having an A-B, for example, morning and afternoon group, while that does reduce the amount of students that would be potentially quarantined, it does nothing for your staff unless you have different staff for your A and B cohort groups. Because obviously any teacher that is exposed to any student in the A group, let's say A group is in quarantine, is obviously the same teacher for your B quarantine or your B group. And if the teachers are all in quarantine, then I don't know who you're holding school with unless you have a lot of really competent subs. So some of the other ways that you can cohort group that should be considered that are more restrictive, but you know, these are things we might have to do as the year goes on if we can't get things under control and stay in school as much as we would like. These are things like A and B weeks, because then, you know, as far as the chance of a staff member cross-contaminating or infecting other groups of kids, there's less chance of that because of that weekend time, that 48 hours, where if someone is placed in quarantine, they are not coming into contact with that second group. Hopefully during that time that you're getting enough warning over the weekend to where you wouldn't necessarily get into that second week and thereby having to quarantine more people. So I think you can see that the biggest effect of quarantine is really on your staff, and the more staff members that you have quarantined, the more that you can't keep all kids in school because you have no one left with which to hold school. And so even though you can come back to school, you know, 2 to 5 days after people have been, you know, people have been cleared and they're not in quarantine, you know, with the rest of the remaining students and staff, you might not have very many staff remaining at that point. I'm just looking through the comments here to see if there's any questions. So if any student tests positive, does the school automatically shut down to allow for contact tracing? Yes, I think, so that's a good question, Neil. So I think we got lucky because ours happened on the weekend. So I got called on that Saturday night and they were able to do all of the contact tracing on Sunday. I do know that had that occurred on a Monday, for example, they would have had to have shut us down that at least a day so that they can contact trace before we could open up. So I do think those 2 to 5 day closures are to be expected, and that would generally be for everyone, so that they can adequately contact trace before you reopen. So it really depends on how many people are affected, how many people they need to get a hold of, and then how your school is set up. So in our case, we are one campus that has all 3 schools, and in particular, our 612 walks back and forth between buildings, while our elementary is pretty self-contained. And so I do think if you can be fairly self-contained, it would only be the one school shutting down and not your entire district. So it really depends on how you're structured. And, you know, a lot of smaller schools, you're sharing buildings. And so that could potentially affect a lot more grade levels and a lot, you know, several schools. So another question, based on this, can we ask what your school is doing for their plan for the fall? Yes, so we are reopening with all of the precautions in place that we used for summer school. So we're doing the enhanced cleaning. I actually think that was probably the most effective measure that we did to prevent the spread of the virus, because we had those 3 kids sitting in class that week and no one else got it. And so we are going to be cleaning bathrooms just like we were, which was frequently hourly cleaning of bathrooms. We're going to be using that again. We bought the 1 gallon weed sprayers, and we have those on a mist setting, and we are misting using a 5% bleach solution. We're going to continue doing that for all desks and chairs, and especially in the 612 between classes, making sure that we do that. We did it with all of our PE equipment. We've been holding open gyms, and we've been using that for doing our, you know, for our balls and just everything that we're touching that's in common. Door handles, we're cleaning those hourly. Just anything that people are touching all the time. So the enhanced cleaning is a huge part of it. The other thing that we didn't allow in summer school, and we're going to carry that over into this school year, is no visitors, because we have 450 students. If we allow, let's say, two parents or 2 guardians per child into our building, that's an additional 900 people in the school at some point. And we just have no idea where those people have been or what they've been up to. And so we are going to stick to a no visitor protocol too. And so those are really the biggest things that we're going to be doing. We have, of course, hand sanitizer. We're keeping everyone in the smallest cohorts we can, and as few cohorts as possible. We'll definitely make sure that our recesses are, you know, we're adhering to those guidelines where they're out in just their cohort groups. We don't want to cross over between groups there. So we are going to reopen with that. We are also offering a completely digital online remote learning option for parents. And at this time, we have about 30 kids signed up for that. We had about 20% of our parents on our survey come back and say they wanted to take advantage of that. So we'll see if that many end up signing up. The presentation I will definitely share with Gary, and then Gary, I think, will put it up on the SAM webpage. There'll be a copy of this presentation.
That's correct.
Okay, great. Thanks, Gary. And then running buses in the fall. We contract to Harlow, so we don't actually run our own buses, but we did a survey on this too, and we have 60 families that ride our buses, and all but 11% came back and said that they would ride the buses. We are going to be doing the increased sanitizing on the buses, and we'll definitely see how that goes. I am really concerned about the buses from the standpoint of, again, you have another cohort of kids. So, you've kept these kids in these strict cohorts throughout the school day, and now all of a sudden you have a fifth grader, a first grader, all these grade levels together on the same bus. And so we'll probably be seating kids on the bus by grade level to try and keep them, again, as close to those cohorts as possible, but also one kid to a seat, those kind of things. Misting only at night. No, we were misting all the time. So the teachers have, every single teacher, every teacher and staff member has their own, it's a 1 gallon weed sprayer. We were misting between classes. When the kids went out to recess, we would do it in the classroom. We would do the tabletops and the chairs, sink handles, because we had sinks in the classrooms, the door handles, those kind of things. So we were doing it frequently, and we had additional staff hired to do that. Our paraprofessionals were doing that in the summer. In the fall, I've hired additional daytime custodians to help do that. Specials teachers traveling to classes, how will you handle PE, library, music, etc.? We're going to keep kids in cohort groups, and those specials teachers are going to go to the classrooms. We don't want to have another space where they have in the elementary where those teachers have to sanitize. So we're going to hold those in classrooms. PE and music, we're going to start by doing them outside, because both of those are areas where our county health was concerned about aerosolized saliva and increased respiration. So our music and PE departments, as long as the weather is nice, are going to start by instructing outside. So there's lots of PE units we can do outside, and our music teachers prepared to do that also. Who is handling digital courses? In-house staff. Yeah, we do have in-house staff, and we are using Acellus, which also has a lot of built-in components of teaching to it. So that's the program we intend to use. Will your entire student body be in the buildings, or is the only option to reduce class size, provide digital learning to those 30 students? So we are going to start out least restrictive and move to more restrictive. So we are going to start out with our entire student body in the buildings. And then, like I just discussed on this cohort grouping slide, we're going to move to more restrictive cohorts as time goes on, or as we have instances of this occur. So we have several different kind of plans for cohorts, how that could look. And I do think at some point we're going to probably end up in a more restrictive setting just based upon illness spread. Also, it will be interesting to see, I mean, we had 29 kids and 6 staff members quarantined, and none of them ended up with coronavirus. If we're quarantining and we're continually experiencing that result, then that would indicate that our precautions are working, or perhaps kids just aren't spreading it as much as adults, or it could be spread. And so that will help kind of guide us too with the cohorts, how restrictive our cohorts need to be. As far as small reading groups and centers, as long as those groups are within the cohorts themselves, we're going to have them. And so this has created a challenge, because we do walk to read down in the K-5, and we are going to be doing that within our cohort groups this year. So each teacher is going to be teaching basically 2 different levels of reading, and we're going to offset that instructional time with interventions for the other group. So maybe while she's teaching the higher group, then the other group would be in interventions, and then flip-flop and teach the lower group, and then the higher group would be in interventions. Normally they would just go to a classroom down the hall, and we kind of just mix and match for our reading groups, but we can't do that this year, because that would create, again, way more kids ending up in quarantine and way more staff ending up in quarantine. Cafeteria plans. We are not using our cafeteria because they would be together for longer than 15 minutes. And so if they're together for longer than 15 minutes, you have to quarantine that entire group. And so we are going to keep our kids in the class that precedes lunch. So whatever period that is for our students in the 612, and then also in the elementary classrooms, they will stay in there to eat. And then as far as recess goes, of course, we have to go out in those cohort groups also. So how are the resource students getting assistance? Yeah, that is just absolutely an area where you either have to send the teacher or the students in, or the paras into the classrooms where they need assistance, or you have to accept that you are just creating another cohort. And so in our case, the cohorts, the SPED cohorts are going to exist. We don't want to not provide the correct services to kids. And that's another area like busing and like sports, where we have to keep really good attendance records, so that if the nurse says they were in this class and this class during the day, I need the list of kids who were in there to contact trace, we have accurate records. Again, going back to one of my earlier slides, this is where the system fails, because a parent may not know all of the classes that a kid was in that particular day. And so county health, when they call us, they don't tell us the name of the student that tested positive. They just said to me, they are in this class, and this class with these teachers. And so if a parent doesn't really know how the kid's entire day looks, including these smaller cohort groups that they might be in, like SPED pull-out groups, or like some sort of additional class that they are in, or perhaps the fact that they're in sports or whatever, then county health would not know to ask us for that information. And that means that perhaps those kids aren't getting quarantined when they should be getting quarantined. And so it was very frustrating for us, because we actually did have, in the case of summer school, we had a reading teacher who was providing reading interventions, and she was pulling kids out of classroom to do that. And it was only certain kids that she was pulling out who needed extra support, who were our tier 2 and tier 3 kids. And we didn't know who these kids were initially until kind of word got out in our community. We didn't know who these kids were. And so we didn't know if she had pulled them out. And so we basically provided a list of kids that she had pulled out to county health, and discovered, yes, she had pulled one of them out, and then she was placed into quarantine also. And so the process is cumbersome because of HIPAA and because of FERPA, and I think there's going to be a lot of potential difficulty there. How big will our cohorts be in the fall? We are going to have, again, we're going to start out least restrictive. So everyone who wants to come back to in-person school will be in their classrooms, in their assigned classrooms. And if we have about 20% of our kids who are taking advantage of the online remote learning from the start, that's going to put our classroom sizes in the low 20s to start with. Where did we get the information for the bleach mixture for the sprayers, the ratio? We got that from County Health Department when we were initially creating our plan. So there are other EPA approved disinfectants that you can use. You know, we happen to choose bleach because it's cheap, and it also it's easy to tell if something has or hasn't been sanitized, because there's with a 5% bleach solution, there's a slight odor, so that you can tell that something has just occurred, that it has just been sanitized. So that was part of the reason that we chose that. If there are other questions up here that I've missed, if you can retype the question, I'm not entirely certain I kept up with everyone's questions. Some additional information I have here just on things I've purchased kind of since, as the summer went on, and as a result of this incident. We did hire a full-time school nurse. We are using our CARES Act money to do this. I really believed, after going through the summer school incident, that this will actually help us kind of not only get information to county health in a timely manner, because our school nurse can kind of help with contact tracing on the school side of things, but also I don't think any of us are really qualified to determine whether a kid should or should not be in school. We don't have medical backgrounds. And so having that school nurse is going to help us navigate that algorithm, that illness algorithm that I showed on one of my earlier slides, of when a kid should or should not be in school. Those are the kind of conversations the school nurse can have with parents or with students to kind of help them through that process. Of course, I hired additional daytime custodial staff to help clean all those bathrooms. We're also purchasing disposable toilet seat covers, the ones that you find in public restrooms, those are going to be in place in all of our bathrooms just to kind of help keep those areas clean. Obviously, that's an area where there's a lot of potential for cross contamination. We purchased handheld UV sterilizers for all, especially for all the shared technology, the keyboards in the computer labs and so on and so forth. Those are areas where you really can't be using liquid or misting them. So those are areas where we'll be using UVC. We bought an electrostatic sprayer because the bathroom sanitizing, once we get rolling with school, we have 18 bathrooms to sanitize. That's a lot more than the 6 we had during summer school. So we just need to be able to do it faster and more effective. The cost for nursing and custodial is coming out of the CARES Act money, yes. And then are we temperature checking every student? We are not. We have all sorts of, we did purchase a lot of the infrared digital thermometers so that every staff member has one, but it's more just to kind of pre-screen kids, you know, the kids that say, I don't feel good, I'm hot. It's kind of a pre-screen before they go to the nurse. We did not do the temperature checks during summer school, and we, you know, it wouldn't have helped us in that case. I should have stressed this, but all 3 of those kids that were in summer school were asymptomatic. Not a single one actually had any symptoms of COVID. They never actually experienced any illness symptoms. So they tested positive, but they were asymptomatic. So given that fact, in that particular case, taking temperatures wouldn't have actually made a difference. I will say that the parent, one of the parents of those children did get sick. And she just experienced aches and pains and lethargy. She also did not have a fever. So at this time, we're not doing mass temperature checks just because it didn't seem to be necessary in the case of our summer school. Handheld UV sterilizers. Actually, we purchased that from one of the vendors that was advertised. Dennis Parman had sent out an email about it a few weeks ago, and that is who we purchased from for that. You can email me directly, Corey, and I'll get you the name of that vendor. I did purchase masks, both disposable and cloth, and I do think, you know, right now, masks are not required in the school. We didn't use them with our summer school. My school board is not in favor of starting out the school year with them. But I did purchase them keeping in mind that as each time we have a closure, each time we have a mass quarantine situation, there has to be kind of additional measures that we take when we come back to put in place to potentially lessen the occurrences of that. And so I do have enough cloth masks to distribute to all the kids. We will be using disposable masks for kids that are coughing or sneezing or have symptoms that are COVID-like, but have been cleared to come to school. So kids who have just a common cold or allergies or things like that, if they're coughing or sneezing kind of continually, they'll be expected to make sure that they're not doing that on other people. So whether they're wearing a mask or a face shield or something, just so that they're not coughing on other people, I think that would cause potentially a lot of alarm. So those are some of the things that we've purchased, just kind of that we thought of more after the experience and learning what we did. So I see my hour is up, and I'm willing to stay as long as needed to answer everyone's questions. But this is basically what I had, is just to share with you. And if you have additional questions, again, I'll stay as long as needed. If you need to depart, by all means, go ahead and go. I appreciate you attending. So you're more than welcome to unmute yourself or type your question if you have it. And again, I will definitely get a copy of this PowerPoint to Gary, and he will put it on the SAM website on the same place where you went to find the link.
Hannah, do you know where you got your gallon sprayers so that they had the correct mist settings? Because some of those, do you have a link, or do you know what you found or what the type was? So, because some seem to have mist, some don't, because the mist seems to make the most sense, so they're not soaking everything.
Right. So I think we just got lucky. We bought them off Amazon, and it has like a dial. And if you email me directly, I will send you the link of what we
That would
bought.
be great. Or can you put it in the chat, or do we have your
Sure.
email?
Yep, absolutely.
So before folks start taking off, I do need a couple follow-up deals here. We do have the Mass business meeting starting at noon. So if you're a Mass member and would like to take part in that, we would appreciate it. That's starting at noon. You can go back to the SAM Virtual Administrators Institute webpage and click into that link. So we will unfortunately be closing this here shortly. So if you guys have questions, maybe use Hannah's email that she just dumped into the chat there. Thank you, Hannah, for your time
You're welcome.
and sharing this experience you had to go through that, although troubling, I think you've learned a lot and were able to share some knowledge. So thank you very much. We really do appreciate it. The other thing I need to say, I'm not sure if these folks are on there, but for one of the wrap-up closing for business partner giveaways, if Mike Ehinger is on there, he won the Silverback giveaway. And yesterday, Horace Mann's winner of the $250 Donors Choose gift card was to Brockton School District, represented by Cindy Glavin. So those folks, you'll be getting contacted by the vendor or the business partner and to claim your prize. So I just wanted to say that we do have to close out of this to get ready for our Mass business meeting. So again, thank you all for attending. Hannah, thank you very much for your presentation.
You are welcome. Thanks, everybody.